Dear colleagues, as we unfortunately had to cancel this year's World Congress in Montreal, we thought it would be a good idea to at least share some highlights from the virtual Congress that took place in February. Before the video starts, I would like to announce that the 2022 World Congress in Taipei, Taiwan will take place from June 9th to the 12th. I look forward to seeing you there in person, and now please enjoy the video. Oh, and don't forget to subscribe to our YouTube channel below for free so you can watch more videos in the next weeks. Thank you.
My name is Kenji Hashimoto, Chiba University, Japan. Today, I will talk about molecular mechanisms underlying rapid-acting and long-lasting antidepressant action of ketamine. This is my disclosure. This slide shows the magazine Time in 2017, the special issue of ketamine, the antidepressant. Depression afflicts 300 million people in the world. 1/3 don't respond to treatment. A surprising new drug, ketamine, may change that. The ketamine antidepressant effects are the biggest breakthrough in depression research in past 60 years. So ketamine is a very, very good hot topics in the psychiatry. This slide is a medical needs for depression. It takes a couple of weeks or months to achieve the antidepressant efficacy the current antidepressant, such as SSRI and SNRI. 1/3 of depressed patients is treatment resistant. The current antidepressants are not effective in the treatment of the depression or bipolar disorder. The current antidepressants are not effective in the suicide ideation of patients with severe depression. Importantly, ketamine covers these unmet medical needs. So we published several papers of ketamine in several animal models of depression. So this is a summary. So ketamine has a greater and longer antidepressant than effects than esketamine in animal model of depression. Importantly, ketamine did not cause a behavioral abnormality in rodents compared to racemic ketamine and esketamine. Collectively, ketamine would be a rapid onset and sustained antidepressant without side effects. Last year, Dr. Lee's group published an open-label study of ketamine in treatment-resistant patients. As you can see, ketamine significantly decreased depression score. So also effect is a 7-day. Light figure is a side effects score dissociation. So as you can see, dissociation after injection of ketamine is very, very low. So this is an open label study using a small sample size. We need a further double-blind placebo-controlled study of ketamine in the future. So question is, what is a molecular mechanism for antidepressant effects of ketamine? So next, we perform the insect hybridization in the mouse brain. This is a prefrontal cortex. As you can see, TGF-beta 1 and its receptor, TGF-beta receptor 1 and receptor 2, are localized in microglia, not astrocytes. So next, we examine the microglia TGF-beta 1 signaling. So colony stimulating factor 1 is a specific marker for microglia. So treatment with a CSF1 alpha inhibitor, PLX, is shown to decrease microglia in the brain. Therefore, we injected the ICV PLX compound. As you can see, a PLX compound significantly decreases the expression of EVA1 and TGF-beta1 in the prefrontal cortex. Also, Western blot shows a significantly reduction of EVA1 in the prefrontal cortex. So, in this study, we examined the effect of PLX compound induce a microglial depression on antidepressant effects of R-ketamine. As you can see, treatment with PLX significantly blocks the antidepressant effects of R-ketamine in CSDS model. So collectively, our findings that microglial TGF-beta1 play a role in the antidepressant effects. This is a summary. So our study, our preclinical study shows that R-ketamine would be a novel antidepressant without side effects, such as psychotomimetic and dissociative effects and abuse liability of racemic ketamine. So our study, intranasal administration of TGF-beta1 shows a rapid acting antidepressant-like effects through the TrkB activation in chronic social deficit stress model. So finally, TGF-beta1 nasal spray would be a novel antidepressant. This is a final slide. This is my collaborator is here. So thank you very much for your attention.
Hello, my name is Lucas Quarantini. I am a psychiatry professor at the Federal University of Bahia, Brazil. And I would like to thank the Congress organization for this invitation. Today, I will present the study that we conducted at our university hospital, intravenous R-ketamine for treatment-resistant depression. Those are my conflict of interest. And to summarize, I will give a brief background about R-ketamine use in human being. I will present the study design, results, and I will discuss the findings and limitation of our study, followed by our conclusions. It's noteworthy that in Brazil, ketamine has been much more prescribed in anesthesiology than ketamine has been used for over than 10, 11 years, almost removing racemic ketamine from our market. Consequently, after the increased use of ketamine in psychiatry, the alternative we had for use was Scatamini. But we had practically no data on Scatamini efficacy many years ago. This situation motivated us to conduct a comparative study between the two molecules. So we performed this study that was the first head-to-head study comparing Scatamine and racemic ketamine. During this study, several papers were published about preclinical data with R-ketamine, and we were also involved with Spravato, the intranasal Scatamini studies. And one question was raised many times in our lab. What happens to all unused R-ketamine obtained from the process of obtaining Scatamine in your local industry once only Scatamine is used? So the first phase of the study is published already, was a short communication demonstrating the results of the pilot study. And the structure of pilot study will be the same structure used in the second phase, the crossover triple blind study. And after eligibility evaluation. Patient received the infusion of ketamine followed by MADRS evaluation in 20 to 40 minutes. CADS in 40 minutes was assessed, and CGI in repeated after 24, 72 hours, and 7 days. And all 7 enrolled subjects finished the study, and they received 0.5 milligrams per kilo intravenous during 40 minutes, and just repeating the MADRS variation from baseline to first day after intervention was the primary outcome. Oh, here's the demographic characteristics of the sample. We had a range from 27 to 65 years old, and we had a range from 2 to 6 previous failure antidepressant treatments, and we are very rigid to exclude subjects with personality disorders, and we obtained the following results. It was very impressive, the reduction of the MADRS score in first minutes. In 60 minutes, we had already efficacy, relevant reduction in MADRS score, but the lower scores were obtained from 120 and 240 minutes, from average from 30.7 to 6.7, and it is interesting because we can see here that the primary outcome, that was the reduction in 24 hours, was obtaining a reduction in more than 20 points in MADRS scale. And we can see here that many subjects maintained the reduction of improvement in 7 days. Discussion first, this was the first study to evaluate the antidepressant action of ketamine in humans with TRD. It was demonstrated with, of course, limitations, effective and fast antidepressant actions, evident efficacy already at 60 minutes, and reduction matters expressively in the first 24 hours. And some questions was it more efficacy than ketamine? Was ketamine? It's impossible to answer. And the main limitations are it's a open study, the first phase, and the second phase is explorative, a pilot study, a proof of concept study with only 10 subjects receiving both interventions. Of course, we have also the order effect. If the subject enter in ketamine, there is a question if he maintained the effect when crossed to placebo intervention. And conclusions are ketamine has a potential for rapid and sustaining antidepressant effect on TRD. However, we can not affirm from the results of this study that the antidepressant action of ketamine is more or less than that of ketamine or ketamine, but was demonstrated good security and tolerability.